The CDC Director, now former CDC Director, Susan Menara, is speaking out for the very first time since being fired and directly addressing what went down from her perspective. Menara's just put out a new op-ed calling out the HHS Secretary, Robert Kennedy, saying in part, and there's a lot in here, this isn't reform, it is sabotage. CNN's Arlette Saenz joining us from Capitol Hill. All of this happening as attention goes to the hallway that you are in right now, Arlette, because our Robert F. Kennedy Jr. is just about to start testifying before the Senate.
Yeah, that's right. We expect Health and Human Services Secretary Robert F. Kennedy Jr. to be up here on Capitol Hill very shortly, where he could face a grilling over the turmoil at the CDC as well as changes to vaccine policy. But just before this hearing is set to get underway, the ousted CDC Director, Susan Menara, is out with a scathing Wall Street Journal commentary outlining how she believes Kennedy and the administration have threatened vaccine policy in the U.S. She specifically said that she was asked to pre-approve the recommendations of a vaccine advisory panel that was handpicked by Kennedy. They are set to meet later this month. And in this Wall Street Journal piece, she wrote, "Those seeking to undermine vaccines use a familiar playbook, discredit research, weaken advisory committees, and use manipulated outcomes to unravel protections that generations of families have relied on to keep deadly diseases at bay. Once trusted experts are removed and advisory bodies are stacked, the results are predetermined. That isn't reform, it is sabotage. Public health shouldn't be partisan," she writes. "Vaccines have saved millions of lives under administrations of both parties. Parents deserve a CDC they can trust to put children above politics, evidence above ideology, and facts above fear." Now, Kennedy's decision to remove members of this vaccine advisory panel did draw some criticism from Democrats as well as some Republicans, like Senator Bill Cassidy. He will be a key figure to watch in this hearing today. This hearing is being held before the Senate Finance Committee, but he leads another Senate committee that deals with Kennedy's agency. And Cassidy was a deciding vote to help confirm Kennedy earlier this year. But Cassidy, even as Kennedy had espoused these anti-vaccine policies throughout decades, Cassidy had said that he had received some assurances from Kennedy relating to the future of vaccines. So that is something that lawmakers, Democrats, and some Republicans likely might question Kennedy about today. Now, just ahead of the hearing, the Democrats on this committee released a statement saying they are calling on Kennedy to resign, saying that he is a threat to public health. So we will be watching this closely to see what angles exactly these senators will have and whether they take an issue with Kennedy's approach so far at HHS.
All right, it's all about to get underway. Arlette is there for us. Thank you so much. John?
All right, with us now is Senator Jeanne Shaheen, a Democrat from New Hampshire. Senator Shaheen, thanks so much for being with us. I know this isn't your hearing today, but this op-ed that we just got from Dr. Menara accusing Secretary Kennedy really of a deliberate effort to weaken America's public health system and vaccine protections. That's coming from someone who ran the CDC, that was nominated, Senate confirmed, had vast Republican support. What do you hope comes out at this hearing today?
Well, I think people are going to want to know from Secretary Kennedy what scientific basis, what data he has that he's basing decisions on, because clearly that's what's going on at HHS under his leadership, is the scientific, the medical data that should be driving our policies is totally being thrown out. And as the former director said, decisions are being made based on partisan, stacked information. And that is not good for the health care of the American people.
On the subject of health care, on an issue you've been working on, I think, very closely over the last several weeks, many people may not be aware that expanded tax credits for ACA, for Obamacare, expire at the end of this year. What impact will that have?
Well, they're going to be aware very soon as they see the information coming through from their insurance companies about what's going to happen to their health insurance rates. We just got back a report that we had requested from the Georgetown University Center on Health Insurance Reform. And what they say very clearly is that the expiration of those tax credits that have been so important to people mean that rates are going to go up the highest that we've seen, the biggest increase that we've seen in a decade. And the people who are going to be most affected are older Americans, working families, people in rural areas, those people who can least afford those premium increases. And what's happening is that people who are healthy, who are going to, because of the changes in President Trump's big, beautiful betrayal bill, as I call it, make it harder for people to enroll in the health insurance marketplace. So those healthy people are going to decide they're not going to enroll, and it's going to mean that sicker people are left in the pool, risk pool. That's going to drive up premiums for everybody. So it's creating a huge issue, and we need to fix it. We need to extend those premium tax credits.
What has been the response from Republicans in the Senate? I don't know if you've been in talks with Republicans in the House as well, because it would need to pass both chambers. One of the president's pollsters, John McLaughlin, actually wrote an op-ed where he said that this is a real threat to Republicans in the midterms if these tax credits expire.
Well, I hope they're hearing from their constituents that they don't want to see their health insurance rates go up, and that they're going to be willing to do something. We've talked to a number of our colleagues who have expressed an interest, but they're worried about what the White House and President Trump says.
Fighting so long and so hard that they don't know what the they're doing.